Good afternoon. Today, I would like to talk about the breathtaking world of respiratory surfactants, unlocking the secret of life-saving molecules, and exploring the fascinating science of respiratory surfactants and their crucial role in maintaining healthy lungs. These complex mixtures of lipids and proteins are produced in the lungs and play a vital role in maintaining proper lung function. In this video, I will provide a more detailed explanation of respiratory surfactants, their structure, and their functions in the respiratory system. We will explore their role in facilitating gas exchange, preventing lung damage, and protecting the lungs from infection. Furthermore, we will also discuss the importance of respiratory surfactant lung development, as well as their implications in various respiratory disorders. I hope that by the end of this video, you will have a better understanding and appreciation for the crucial role that respiratory surfactants play in our respiratory system, significance of their role in maintaining our overall health and well-being. Thank you. What do you mean by respiratory surfactants? Respiratory surfactants are a complex mixture of lipids and proteins that are synthesized and secreted by specialized cells called alveolar cells in the lungs. These surfactants are essential for the proper functioning of the respiratory system as they reduce the surface tension of the fluid lining the alveoli, which are tiny air sacs in the lungs where gases exchange occurs. First, let us imagine what happens in the lungs without respiratory surfactants. During exhalation, the surface tension of the fluid lining the alveoli would cause them to collapse and stick together, making it difficult to fully empty the lungs. This would cause a buildup of carbon dioxide and a decrease in oxygen exchange, leading to respiratory distress and damage to lung tissue. Over time, this damage could lead to chronic respiratory conditions such as emphysema or chronic bronchitis. Respiratory surfactants work by reducing the surface tension of the fluid lining the alveoli, which are tiny air sacs in the lungs where gas exchange occurs. Without these surfactants, surface tension in the alveoli is high due to the presence of water molecules. Surface tension causes the alveoli to collapse during expiration, making it difficult to exhale air and leading to reduced gas exchange in the lungs. Lung compliance is decreased, making it harder to expand the lungs during inhalation. Additionally, respiratory surfactants also play a critical role in protecting the lungs from infection and other types of damage. Now we will discuss about composition of respiratory surfactant. The composition of respiratory surfactants can vary depending on factors such as age, disease state, and environmental exposures. However, the main components of respiratory surfactants include phospholipids, surfactant proteins, neutral lipids, and trace elements. Phospholipids are the primary lipids found in respiratory surfactants, and they help to reduce surface tension by creating a hydrophobic layer at the surface of the alveoli. This layer helps to prevent the alveoli from collapsing during exhalation, which is important for maintaining proper lung function. The most abundant phospholipid in respiratory surfactants is phosphatidimethylene PCO, for approximately 70 to 80 of the total phospholipid content. Other phospholipids found in respiratory surfactants include phosphatidylglycerol (PGF), phosphatidylsilicyl pi, and phosphatidylmethionol (PO). Surfactant proteins, including SPB, SPC, and SPD, play a variety of roles in respiratory surfactants. SPB and SPC are hydrophobic proteins that are involved in reducing surface tension at the surface of the alveoli. SPD and SPD, on the other hand, are hydrophilic proteins that are involved in the innate immune response of the lungs. SPD and SPD are members of the collecting family of proteins, which are involved in recognizing and binding to pathogens and other foreign substances. Neutral lipids, as cholesterol and triglycerides, stabilize the surfactant mixture. Cholesterol is particularly important for stabilizing the hydrophobic proteins SPB and SPC, essential for reducing the surface tension. Trace elements like calcium and magnesium help to maintain the proper pH balance and stability of the mixture. Calcium is also important for activating certain enzymes involved in the synthesis and secretion of respiratory surfactants. The synthesis and secretion of respiratory surfactants is a complex process that involves several enzymes and other molecules. The synthesis of phospholipids begins in the endoplasmic reticulum of alveolar cells and continues in the Golgi apparatus. The final mixture of lipids and proteins is packaged into lamellar bodies, which are then secreted into the alveoli. The production of respiratory surfactants is regulated by several factors, including oxygen tension, glucocorticoids, and thyroid hormones. Low oxygen tension, as occurs at high altitude, can stimulate the production of respiratory surfactants. Glucocorticoids, which are steroid hormones produced by the adrenal gland, can also stimulate the production of respiratory surfactants. Thyroid hormones can also stimulate the production of respiratory surfactants. This is because these hormones increase the activity of certain enzymes involved in the synthesis of phospholipids. Deficiencies in respiratory surfactants can lead to a variety of respiratory disorders, including respiratory distress syndrome addressed in premature infants, acute respiratory distress syndrome (ARDS), and chronic obstructive pulmonary. Now we will discuss about functions of respiratory surfactants. The main function of respiratory surfactants is to reduce the surface tension of the fluid lining the alveoli, facilitates expansion during inhalation, and prevents collapse during exhalation. However, respiratory surfactants have several other important functions that are essential for maintaining proper lung function and overall health. In this speech, we will discuss the various functions of respiratory surfactants in detail. First, we talk about reduces surface tension of fluid lining alveoli. As mentioned earlier, the main function of respiratory surfactants is to reduce the surface tension of the fluid lining the alveoli. The respiratory surfactant reduces the surface tension of this fluid, making it easier for the alveoli to expand and contract during breathing. This, in turn, facilitates efficient gas exchange between the lungs and the bloodstream. In addition to reducing surface tension, respiratory surfactants also play an important role in facilitating the clearance of lung fluid. The lungs are constantly exposed to a variety of environmental toxins and pathogens that can cause lung infections and other respiratory diseases. The respiratory system has several mechanisms in place to protect the lungs from these harmful substances, including the production of respiratory surfactants. These surfactants help to prevent accumulation of excess fluid in the lungs by promoting the clearance of fluids and particles from the airways. Second function, prevents atelectasis, a condition where alveoli collapse and become unable to exchange oxygen and carbon dioxide with the blood. Factors, including a decrease in lung volume, a blockage of the airway, or the compression of lung tissue. One of the primary functions of respiratory surfactants is to prevent atelectasis by reducing the surface tension of the fluid lining the alveoli. As mentioned earlier, this fluid has a high surface tension, which makes it difficult for the alveoli to expand during inhalation and prevents their collapse during exhalation. Respiratory surfactant acts to decrease the surface tension of the fluid, which reduces the force necessary to keep the alveoli open during breathing. This means that the alveoli can expand more easily during inhalation, and they are less likely to collapse during exhalation. Respiratory surfactants help to keep the alveoli open by recruiting adjacent alveoli to help support and maintain their structure. This is known as interdependence or alveolar recruitment, and it is essential for the proper function of the lungs. Respiratory surfactants to reduce surface tension and maintain the structure of the alveoli is critical for preventing atelectasis and ensuring efficient gas exchange in the lungs. Now we understand how respiratory surfactants maintain lung stability and structural integrity. Lungs are composed of millions of smaller sacs called alveoli. These alveoli are responsible for exchanging oxygen and carbon dioxide with the bloodstream. The structure of the alveoli is critical for their proper function, and any damage or instability can impair gas exchange and lead to respiratory dysfunction. Respiratory surfactants play a crucial role in maintaining lung stability and structural integrity by reducing surface tension and preventing the collapse of the alveoli. Without surfactants, the surface tension of the fluid lining the alveoli would be too high, and the alveoli would not be able to remain open during breathing. This would result in the collapse of lung tissue and a decrease in lung function. Furthermore, respiratory surfactants help to maintain the structural integrity of the alveoli by recruiting adjacent alveoli to help support and maintain their structure. This interdependence or alveolar recruitment helps to ensure that the alveoli are structurally stable and that they maintain their shape during the breathing cycle. In addition to their role in maintaining lung stability and structural integrity, respiratory surfactants also play a role in protecting the lungs from infection. Some of the surfactant proteins have unbreakable properties that help to defend the lungs against pathogens such as bacteria and viruses. By reducing surface tension, preventing collapse and recruiting adjacent alveoli to maintain structure. Respiratory surfactants help to ensure that the lungs can effectively exchange oxygen and carbon dioxide, even in the face of external stressors such as inflammation or infection. For function, how respiratory surfactants can reduce inflammation in the lungs by modulating the production of pro-inflammatory cytokines and chemokines. Inflammation is a complex physiological response to injury, infection, or irritation. It is a normal and necessary response of the immune system, but excessive or uncontrolled inflammation can cause tissue damage and contribute to a variety of diseases, including respiratory diseases. Respiratory surfactants contain proteins that have been shown to modulate the production of pro-inflammatory cytokines and chemokines. Cytokines and chemokines are small proteins that play critical roles in regulating the immune response in inflammatory processes. They are produced by immune cells in response to infection, injury, or inflammation, and they can recruit other immune cells to the site of inflammation. Research has shown that certain surfactant proteins, such as speed and speedy, can modulate the production of pro-inflammatory cytokines and chemokines in the lungs. In addition, surfactant proteins can directly interact with immune cells such as macrophages and dendritic cells to regulate their production of cytokines and chemokines. For example, speed and speedy have been shown to inhibit the production of pro-inflammatory cytokines such as 10-phelan and IL-1 and increase the production of anti-inflammatory cytokines such as IL-10. Furthermore, respiratory surfactants can directly interact with the surface of bacterial and viral pathogens, preventing them from attaching to invading lung cells. This can help to reduce the burden of infection and inflammation in the lungs. By dampening the inflammatory response, surfactant proteins can help to reduce tissue damage and promote healing. This function is particularly important in the context of respiratory diseases, where uncontrolled inflammation can lead to lung damage and impaired lung function. Fifth function enhances immune function of the lungs. With proteins that have antimicrobial properties and modulate the immune response, respiratory surfactants also play an important role in enhancing the innate immune response of the lungs. The innate immune system is the first line of defense against invading pathogens and other harmful substances. The lungs are particularly vulnerable to infection due to their constant exposure to environmental toxins and pathogens. The production of respiratory surfactants is an important part of the innate immune response, as these surfactants contain specific proteins that help to identify and neutralize invading pathogens. For example, surfactant protein aspartate, a component of respiratory surfactants that helps to identify and clear bacteria and viruses. Now we will discuss about types of respiratory surfactants. There are main types of respiratory surfactants: natural, synthetic. Natural respiratory surfactant is the type of surfactant that is produced naturally by the lungs. It is composed of a mixture of lipids and proteins that work together to reduce surface tension in the lungs and maintain proper respiratory function. Synthetic respiratory surfactant, on the other hand, is produced artificially and used as a medical treatment for respiratory distress syndrome addressed in premature infants. In the following speech, we will discuss in detail the differences between natural and synthetic respiratory surfactants. First type of respiratory surfactant is natural respiratory surfactant. This is the type of surfactant that is produced naturally by the lungs. It is composed of a mixture of lipids, fats, and proteins. The lipids in natural respiratory surfactant are primarily phospholipids, which have hydrophilic water attracting and hydrophobic water repelling regions. These lipids help to reduce the surface tension of the fluid lining the alveoli, making it easier for the alveoli to expand during inhalation and preventing their collapse during exhalation. The proteins in natural respiratory surfactant have a variety of functions. The second type of respiratory surfactant is synthetic respiratory surfactant. This is a type of respiratory surfactant that is produced artificially and used as a medical treatment for respiratory distress syndrome addressed in premature infants. Synthetic respiratory surfactant is composed of a mixture of lipids and proteins that are similar in composition to natural respiratory surfactant. However, synthetic respiratory surfactant is produced using recombinant DNA technology and is usually administered as a liquid directly into the lungs of premature infants who are at risk of developing DRESS. Synthetic respiratory surfactant helps to reduce surface tension in the lungs and Now we will discuss about clinical applications of respiratory surfactants, which includes 1. Treatment of stress or respiratory distress syndrome. 2. Treatment of ARDS, acute respiratory distress syndrome. 3. Lung transplant. 4. Treatment of chronic obstructive pulmonary disease. 5. Treatment of asthma. 6. Treatment of cystic fibrosis. Now we will see how respiratory surfactants helps treatment of stress or respiratory distress syndrome. Respiratory distress syndrome addresses a condition that commonly affects premature infants. Here's because their lungs do not produce enough surfactant, which is necessary to reduce surface tension in the lungs and keep the air sacs open. This can lead to difficulty breathing and other complications. Natural respiratory surfactants derived from animal sources or human donors can be administered to these infants to help improve lung function and reduce the risk of complications. Acute respiratory distress syndrome (ARDS) is a condition that can occur in adults due to lung injury, infection, or inflammation. ARDS can lead to buildup of fluid in the lungs, making it difficult to breathe. Synthetic respiratory surfactants can be used in the treatment of ARDS to help improve lung function and prevent further lung damage. Lung transplant. Respiratory surfactants can be used during lung transplant surgery to help prevent complications such as atelectasis, a condition where the lung collapses due to a lack of surfactant. This can improve lung function and reduce the risk of complications after the transplant. Treatment of chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease, COPD, is a progressive lung disease that makes it difficult to breathe. It is caused by long-term exposure to irritating gases or particulate matter, such as cigarette smoke. COPD can lead to damage of the air sacs in the lungs, making it difficult for oxygen to be transported to the body's organs and tissues. Studies have shown that respiratory surfactants may help improve lung function in patients with COPD by reducing surface tension and improving gas exchange. Treatment of asthma. Asthma is a chronic respiratory condition that causes inflammation and narrowing of the airways. This can make it difficult to breathe and may result in wheezing, coughing, and shortness of breath. Respiratory surfactants may have potential as a treatment for asthma because they can reduce the amount of work that the lungs have to inflate and deflate, making it easier to breathe. However, more research is needed to fully understand the potential benefits of respiratory surfactants in treating asthma. Treatment of cystic fibrosis. Cystic fibrosis is a genetic disorder that affects the lungs, digestive system, and other organs. The cystic fibrosis, the thick, sticky mucus builds up in the airways, making it difficult to breathe and increasing the risk of lung infections. Respiratory surfactants may help improve lung function in patients with cystic fibrosis by reducing surface tension in the lungs and improving gas exchange. However, further research is needed to fully understand the potential benefits of respiratory surfactants in the treatment of cystic fibrosis. Now we fastly summarize the whole topic. Respiratory surfactants are natural or synthetic molecules that play a crucial role in maintaining lung function by reducing surface tension in the alveoli, thereby preventing their collapse. The production of respiratory surfactants begins during fetal development and continues throughout life, but premature infants may not produce enough respiratory surfactant, leading to respiratory distress syndrome. Particularly animal-derived surfactants has greatly improved the survival rates of premature infants with stress. Synthetic respiratory surfactants are also being developed to reduce the need for animal-derived surfactants and to improve the efficacy of surfactant therapy. Respiratory surfactants may also have potential therapeutic applications for other lung conditions. Respiratory distress syndrome (ARDS). Understanding the structure and function of respiratory surfactants can lead to the development of more effective therapies for respiratory diseases and a better understanding of the biology of lung function. Thank you for listening to this speech on respiratory surfactants. I hope that you have gained a greater appreciation for the essential role that these molecules play in lung function and health. As we continue to learn more about the composition and function of respiratory surfactants, we can develop new therapies and interventions to improve respiratory health and prevent lung disease. Thank you once again for your attention, and have a great day.